Good morning. My name is Maribel Fernandez, and I will be making a reflection video on collaboration and leadership. During this reflection video, I will consider how a multidisciplinary partnership went well or poorly in achieving the desired goals, identify how a lack of interprofessional cooperation leads to ineffective human and fiscal management. Use the research to identify successful leadership practice for improving an interprofessional team's capacity to achieve these objectives. Identify ideal multidisciplinary collaboration methods to enable a team accomplishes objectives and collaborative effectively. Back up my assertion with appropriate existing literature citing the rights of the work references. My experience. I recall all the staff members from the administration and patient care sides of government health institution being convened for the practical disciplinary teamwork discussion at my former workplace. I was an emergency session owing to an increase in the number of critical patient information leakage incidents as a result of inadequate electronic health record, EHR. Administration. The EHR was shaky, putting patient safety at risk. The conference included a prominent congressman who leaked medical information to the press. All healthcare staff and entities must ensure the confidentiality, privacy, and safety of patients' health information with may HIPAA take disciplinary action against the hospital by imposing a heavy fines. The healthcare insurance portability and accountability as a HIPAA is a legislative act that was designed to ensure that medical health information is kept confidential and safe. Unless a specific assumption exists, such as treatment or procedures, HIPAA's privacy rule typically involves documented patient consents to share sensitive patients' information by the organizations Cohen and Mello 2018. I had developed outstanding problem-solving abilities after working with the executive officer of healthcare technology numerous times. Through the time, the health informatives coordinator was in charge of a critical initiative that needed to be completed in 2 days. As a result, he tasked me with working with the interprofessional team to identify and fix any misleading viewpoints to ensure that the error never occurs. Every interprofessional team member was needed to identify a solution to this problem, with the most substantial and most long-term answer being chosen. EHR are crucial since they have made therapy more manageable and less inaccurate while increasing patient experience and promoting scientific proof care. According to the observations, health providers were not vigilant while monitoring patients' records, turning off the data or obscuring it from undesired persons and exchange credentials, resulting in the leak of confidential clients' records. Reflective practice ingests a behavioral competence that requires a deliberate attempt to examine a problem while being mindful of one's views, ideals, and conduct. It allows caregivers to learn and develop from occurrences and use what they have learned to improve patients' care results. It also contributes to advancing nursing skills, Patel and Mestre 2021. Working in the health informatics department over the past 3 years has taught me that technology advances are upgraded or adjusted to meet the demands of users. As a result, I offer several EHR modifications, including biometrics, fingerprint scanners to verify the identity of person accessing to the EHR at any given moment. Fortunately, the solution I proposed was accepted, and the contribution of my multidisciplinary partnerships improved it. In addition, I advise developing an automated mechanism that ensures lawn off after a few minutes of inactivity. The team decides to use my approach in combination with other efforts, such as prohibiting staff from obtaining patients' records via hospital equipment. The measure will be led by the Health and Information Technology (HIT) division. As a result, the IT manager talked with a EHR provider. We approved developing the technology personalization abilities. Coordination, communication, collaboration, regard, trust, and responsibility were critical components that enable the interdisciplinary team to achieve its objectives. Effective groups interactions, such as the pharmacy representatives' ability to interact freely with the IT department, was vital in the project achievement. The IT staff offer frequent updates on the project progress, which relieve some of the administration burden from the commencement to the task. The teams had a clear understanding of the task, as evidenced by their unwearying coordination and collaboration. How lack of interprofessional collaboration leads to ineffective humans and fiscal management. Interdisciplinary cooperation between doctors, caregivers, and other healthcare staff in the team is showing to raise the collective conscience of each other type of knowledge and expertise. Poor teamwork compromises patients' treatment and safety by creating shortfalls in treatment and information supervision by accountable healthcare personnel. Furthermore, attempts to enhance patients' outcomes are deliberate by a health system that presumes that necessity for cooperation, resulting in raising healthcare costs. Ineffective handling of integrated duties within a group is caused by poor cooperation, making it difficult to design better strategies to improve care delivery. Patient discontent, diagnosis errors, delays in treatment, prescription mistakes, and physical harm or fatalities results from ineffective communication caused by poor interprofessional teamwork. Stewart 2017. Furthermore, inadequate communication, cooperation, and responsible partnership cause bad sentiments among healthcare personnel, resulting in turnover, exhaustion, and psychological degradation. Employees may operate autonomously without appropriate resources, without proper coordination, lowering their enthusiasm due to dissatisfaction. It became difficult to exchange ideas and take leadership responsibilities in the health system rebranding. Furthermore, poor collaboration leads to human overexploitation, resulting in wastings and curtailing the expansion of multidisciplinary teams. It is critical to embrace cooperation to promote effective financial and human resources utilization to improve patient safety and clinical status. Best practice leadership strategies. Transformational leadership is a leadership paradigm in which a leader influences teams to recognize transformation and create a vision to steer the change via impact, motivation, and execution in collaboration with dedicated group members. Transformational leadership is seen as necessary for improving patient safety, helping in striking a balance between organizational support and job requirements, and fostering a strong safety climate for patients in healthcare organizations. Sajemo 2020. Referent power, inspiring motivation, intellectual challenge, and individualized consideration are characteristics of transformative leaders. These leadership qualities help workers move above their demands and goals to benefit the entire team. The transformational leader will also recognize organizational needs and try to change the norms of the institution for the betterment of the organization. They should enhance communication such as being upfront about prevalence of infections by encouraging healthcare providers to regularly report what is functioning and not functioning for them in their line of work. Third, future incoming leaders are developed through mentoring. So that is a particular leader in absence The protege can step into the insurance that nursing performance and patient care do not deteriorate. Lastly, leaders should ensure that there is access to care resources. Condensation and results from inadequate facilities, such as employees, tools, equipment, and information. Intangible assets, including connections, opportunities to progress, and assisting in addition to tangible assets. Nurses leaders must be visible and reachable since they are helpful resources. Healthcare leaders should be ensure that employees have their facility for care delivery, which is especially significant in the conditions of the healthcare. As leaders are under pressure to save costs, nurse managers must fight to preserve facilities that they are important to their colleagues, such as educational support, shared leaderships, and staffing partners. Ideal multidisciplinary collaboration methods to enable a team accomplish its objectives as a collaborative effectively. Team steps, team strategy, and tools to enhance performance and patient safety. It is a structured strategy to improve teamwork abilities critical for providing high quality, safe treatment. Team steps is a method of planning, executing, and maintaining team training. It is given as a versatile training kit that aids in the development of a customized strategy. The method encourages competencies, techniques, and the applications of systematic procedures in 5 areas of group work, team composition, leadership, interaction, scenario observation, and mutual assistance. Team steps also emphasize organizational changes, training assessments, and execution. Simulation based instruction is based on single method simulation. Simulation is a method for replacing or enhancing actual patient encounters with supervised technologically. Manufacture encounters that mimic or duplicate significant parts of the real world in the thoroughly engaging way. Simulating situation can take several forms, such as individual acting or dummy patients, and are developed around the clinical situations, such as resuscitation, to improve practical and non-technical abilities, such as a multidisciplinary collaboration and communication. Technology can facilitate collaboration. Communication technology improves cooperation by allowing professionals to participate and communicate from afar. Technology can create an opportunity to disseminate knowledge via information forums, tools that analyze and shows data, such as dashboards, metrics, might encourage collaboration. The data acquired does not indicate teamwork outcome, but it does motivate to reflect on an improved collaboration. Exchanging information on encounters, such as a clinical anecdotes and daily thinking, can help active group dynamics, for example, reflection. Conclusion. To summarize, my medical encounter has influenced my work, as have the arrangements made to accomplish this video presentation. As a nurse practitioner, I have identified areas that I need to improve and abilities to leverage to bring about healthcare reform. I also want to express my gratitude for the ongoing assistance at work. Therefore, I have discovered that fantastic things occur when professionals from other fields neglect their personal ideologies, hence the exact definition of workplace diversity. My references for these works are Burstick, We 2020 Leadership Strategies to Promote Frontline Nursing Staff Engagement, Nursing Management, and then I have Buldak, Samardik, Doki, Van Genar 2020 Interventions to Improve Team Effectiveness within Healthcare, a systematic review of the past decade. I have Buzari Mall 2017 Understanding the Impact interprofessional collaboration on the quality of care, a case report from a small scale source limited healthcare environment. I have Cohen, HIPAA, and protecting health information in the 21st century. I have Patel, Metarsky, reflective practice in nursing, a concept analysis. I have Sodelmo, 2020, the role of transformational leadership, job demands, and job resources for patient safety culture, energy, and nursing homes, a cross-section study. I have Stewart, 2017, Stuck in the Middle, the impact of collaborative interprofessional communication on patient expectations, shoulder and elbow, 66 and 72. Thank you very much for your time, and I hope that this video is helpful. Thank you.